Hi, I'm Kelly Vaughn, and welcome to Inside Indy. And tonight, we're going to Marian University, and we're going to meet the new dean at Klipsch Educators College at Marian University. She is Dr. Latonya Turner. Welcome to Inside Indy.
Thank you for having me, Ms. Vaughn.
You are the new dean at Klipsch Educators College. Now, when did this take place? I know it's relatively new.
Yes, ma'am. It took place July 1.
Very nice, very nice.
So very new, very new.
And I love it. Well, congratulations. And in light of what's going on in our country, Black Lives Matter, and I just am so impressed with this move that Marian University has made and putting you in that position. Tell us what your new role entails and how you got there.
Sure. So I was the associate dean of the Klipsch Educators College. So I'm not new to Marian University at all. I've been at Marian, I'm going on my 7th year. I think it's my 7th year. And prior to stepping into the role of associate dean, I was the assistant director and then the director of the Academy for Teaching and Learning Leadership here, which is focused on leadership preparation, preparing our teachers and to be future principals to lead schools. And so again, I'm not new to Marian at all. And so that was kind of my ascent into this role right now.
I love it. I love it. So now tell us a little bit about Klipsch Educators College. So is that a school within the school at Marian University? How does that work?
Sure. Yes, ma'am. It is one of the colleges or departments here at Marian University. So we have the Klipsch Educators College, the Byram School of Business, we have our College of Arts and Sciences, and then we also have our medical school. So we operate in 3 different professional realms, so to speak. And the Klipsch Educators College is responsible for or focused on recruiting leaders, those who want to become principals, as I mentioned before, but also our main focus is on teacher preparation. So preparing those aspiring teacher candidates, both who have been out in the work world, who may already have their bachelor's degree and want to transition into teaching, and for those who are newly minted, who are coming into the baccalaureate program, who want to seek their bachelor's degree in education.
Okay, gotcha. So what inspired you to get into education? And tell us a little bit about you in terms of where you're from and your background.
Sure. So I'm not originally from Indianapolis. I like to say that I am from Danville, Illinois, by way of Florida. My family is originally from Florida. Both of my parents were longtime educators. My mother, an elementary school teacher for over 30 years, and my father, an English teacher for over 30
Wow.
years. And he had a few other jobs in there as assistant athletic director and dean of a high school as well. So I always say that I am from Danville, Illinois, by way of Florida. My parents moved us from Florida when I was about 5 years old, 6, because they had a teacher strike going on in Florida, and my parents did not want to cross the picket line. So I already had family members in Danville, Illinois, and they encouraged my parents to come on up north, and so that's how we ended up in Danville.
Okay, very nice. And then you moved to Indianapolis.
Yes. So I migrated over to Indy back in the 90s, worked at Valparaiso University in admissions. So I took some time out from teaching, and I said took some time out from teaching. Let me back up just a little bit to tell you a little more about my story. I didn't start off in education, even though both of my parents were longtime educators, and a number of my family members are educators as well. I just did not have that bug initially to go into education. Instead, I wanted to be like you. I went into mass communications initially, and I worked for a newspaper for a while. But after a few years, probably about 3 years, I decided that something was missing in my life and decided to go pursue my education degree and went to a transition to teaching program and became a journalism teacher, English and journalism teacher in Illinois, and then migrated over to Indiana. As I mentioned, I kind of took a stop out from teaching and worked in admissions, and that's how I ended up coming over to Indiana. Eventually met my husband, who was in
Mhm.
law school at Valparaiso University. And once he graduated from law school, we moved up a little, or should I say more central Indiana to Lafayette, where we both worked at Purdue University for a few years. And then eventually I decided that I wanted to go back into education, but
Nice.
I decided to go into counseling at that point in time and went back and got my counseling degree and did that for a little bit and eventually became an assistant principal and principal in the K-12 world.
Oh, wow. Okay. So not only are you teaching people, you've actually done it. You've been through it.
Yes,
So,
ma'am, I have.
well, let me assure you, you made the right choice to go in as an educator versus a journalist. Because you mentioned earlier something was missing. It's called a paycheck. Okay.
I know.
You didn't tell me you were going to preach today, but yeah. So, yeah, you made the right decision. Um, so what is your biggest piece of advice for anyone looking to become an educator, and especially in light of what's going on in our nation now? Of course, our educators aren't even able to get out there and educate as we normally do. But any thoughts on that, and what advice you would give someone
Um,
contemplating going into education?
to me, education is a calling. You don't go into education. You just mentioned, Ms. Vaughn, about journalism and a paycheck. Education, the reality is you don't make a lot of money in education either. So someone who's interested in going into education really has to have that heart to serve and want to make a true difference in the lives of children and their families.
Mm-hmm.
That is what I think about when going into education. It's not for the faint of heart. There are some long hours, there are some stressful times, but the reward at the end of it all is unfathomable. I think about my time in education. It's been over 20 years now, and to see the evolution of many of my students who I had back in 1990, 9 or so, and still connected with them to this day, and seeing the difference that they are now making in the lives of others, whether they have decided to go into education themselves or into other professions, has been just awe-inspiring. And I think it's important for us to remember that you can't have the other professions without teachers first.
Right. Yeah. So, do you have and we've got just about 4 minutes left. Do you have a story that you'd like to share about a particular student that you saw how you being an educator had an impact on them and them impacting others?
Well, I think about one of my students in particular, and she's going to probably kill me right now. I was actually at her school because she just opened up her own school in collaboration with Eastern Star Church, and it's the Rooted School. And her name is Mayat Lands. And I had Mayat as a freshman at North Central High School. I was actually her guidance counselor and her track coach. And from 1999 or so till now, we've remained in contact with one another. And to see her graduate high school, to see her go on to college, and then on to get an advanced degree, and now open up her school, because she is just that type of young lady who is committed to serving her community and making a difference in the lives, a transformative difference in the lives of the families that she serves, has been amazing. It's just been so, I'm grateful to have been on that journey and continue to be on the journey with her as she continues to evolve.
Wow. And I guess it's kind of nice to see the fruits of your efforts and labor. Sometimes you never get to see what's going to happen in the future. We
You're
long
so
gone,
right.
you've impacted somebody, you don't get to see it. So that's a blessing in of itself. So what is your vision for education, whether it be your personal vision or that aligns with Klipsch Educators College at Marian?
What I'd like to see in education is that we do a better job of partnering with parents, helping them or equipping them with the tools necessary to truly be their child's teacher, their first teacher, That's one vision that I have. Another vision that I have is ensuring that all students, regardless of socioeconomic background, have the same quality of education that some of our students who are coming from some privileged backgrounds. So that's what I'd like to see. And I think that we are equipping our students here in the Klipsch Educators College to do exactly that. And when I say do exactly that, I say they're committed to being that transformative educator that we so need out in our communities. And as long as they are open to serving and open to be, I can't say enough, that transformative figure in the lives of the families that they serve, I have no doubt that they will build upon the vision that I just espoused, which is to ensure that we equip our parents to be their child's first teacher and to ensure that our students, regardless of socioeconomic background, are able to have the same quality or high quality of education that those who come from a bit more wealthier or privileged background have.
Okay, sounds like you're creating there the Klipsch Educators Parental Educators College, a course specifically for parents to better, be in line with what your educators are doing to help them do their jobs better. So that's I don't know. That may be something that's
I
coming.
know that that's a thought. I just don't think that we do enough with our parents and partnering with them, because I'm a firm believer, Ms. Vaughn, that our parents don't set out to say, I don't want the best possible for my child. They do. Sometimes they just don't know how to go about that. And so we need to do a better job as educators because we have that information. We need to do a better job of equipping our parents with that as well.
Okay. Well, we have information on the screen about about the Klipsch Educators College at Marian University, and we thank you, Dr. Latonya Turner, who is the new dean there. Thanks so much for joining us.
Thank you for having me.
Here is my handle and here is my spout.
When I get all steamed up, then I shout.
Tip me over and pour me out. Oh.
It only takes a moment to make a moment.
Cheers.
Take time to be a dad today.
Hi, I'm Kelly Vaughn, and welcome back to Inside Indy. And we have a very special guest in the interview, and not just because she is the executive director of Independent Adult Day Centers, she is also a Broad Ripple Rocket. She is Regina Smith. Welcome to Inside Indy, Regina.
Thank you. Thank you for having me. I'm so honored to be here today.
Well, we're honored to have you here, and folks are dying to know more about Independent Adult Day Centers. Who are you guys, and what do you do in the community?
Okay, good question. So who we are an adult day service. We provide services to older adults that are living with all types of cognitive challenges or diagnoses, whichever you like to say. Some of our guests are living with dementias and Alzheimer's. Some of our guests are living with post-strokes, and some of them are intellectually disabled. So they run a full gamut. They're aged 18 and above. Our average guest is about 72 years of age. Old, we have older, and we do have a guest in our current state about 24. So 18 and above is who we see and care for. Yeah.
Oh, so how when one signs up there, how does that happen? Or somebody signing them up? Tell us, and how you benefit and you help families with this this challenge that they face in caring for someone who is an adult?
Yeah. So pretty much the services that we provide kind of, the need arises from that caregiver who is at home, a daughter or son, a husband, a wife, a friend who has been a caregiver to someone, and they still have to work, or they're tired, they're weary. I was a caregiver to my mom, and going to school full time and working full time. And so even being in this industry, I just didn't know what to do with myself. And so somebody said, why don't you bring your mom to the center? So that was just a simple phone call, inquiring, what do you guys provide? Because I'm in this setting, I knew what we provided, of course, but even though I knew what we provided, I didn't think my mom's needs could be met here because she was on oxygen, because of the dementia, the type of dementia that she had. But when I brought her in this environment, oh my goodness, some of those symptoms went away.
Are you serious?
I'm so serious. She started she started remembering more because she started doing what she saw other people doing, like drinking water. She would never drink anything, but if she had someone there to eat and drink with, she got that in. So those types of benefits definitely are what I needed, because I couldn't be at home with her. Mom, you need a drink. Mom, you need to eat. Mom, let's go to the bathroom. But here in this environment, that's what we can do. We can get those toileting needs met. We can get that med management met. I could get those because another thing we offer is the healthcare coordination, which is phenomenal, which is very different and unique from other adult daycares, which I know you didn't ask that question, but I'll just roll right into it.
Hey, take it, run with it. I'm good.
Yeah,
Make
so
my job easy.
yeah, so one of our what sets us apart too with Adult Day is that we have the healthcare coordination, which is phenomenal because in healthcare coordination, that caregiver can't always take off their job and be at these doctor's appointments, or they have to take off their job and be at these doctor's appointments, or they're overwhelmed with their own healthcare issues and not always managing their loved ones' health issues as well, or mismanaging their own. With the healthcare coordination, for me, I was able to get my mom to the doctor without missing a beat. That nurse or the CNA went with my mom. They were able to give me a full report on what happened at that appointment, what the next steps were with that appointment. They set the transportation up for me. They took them. And so that's the same service we offer. We offer that door to door. We pick your loved one up from their home. We get them on our transportation. We bring them to the center if they're coming here. We take them to their appointments if they're going there, and not just to a doctor's appointment. We help them with their social services if they need to get down to the light company and handle that situation or whatever. So that's some of the benefits of Adult Day as far as the services that we provide. When I'm looking at services, or when we're looking at benefits as far as helping reduce hospitalization.
Wow.
Because
that's huge.
That's huge. So many caregivers are running back and forth to the emergency rooms, especially with COVID now.
Oh, yeah. And I've been there. My mother, and it's interesting because you talked about the challenges that some of the patients at the adult center have. My mother was pretty much just like you and I. She hadn't had a stroke or anything like that, but she did have sarcoidosis. And so the pain and the discomfort, a lot of times she was running back and forth to the emergency room. And so I didn't feel like she belonged in a nursing home, but she did require a doctor looking at her probably 3 or 4 times a week, as opposed to, once a month. And so we were like, how do we do this where she can get the care she needs, but she doesn't need that kind of care like a nursing home, because otherwise she's walking around the house like you and I. So I can totally relate to, this would have been perfect for her.
So in a setting, sort of like with your mom, well, we don't have physicians here, but we do have the RN oversight, and we
Mhm.
have LPNs and CNAs, and we have physical therapy and occupational therapy. So those therapies take place in our setting, which is phenomenal because again, that alleviates the caregiver from having to either set that therapy up in their home or transporting that therapy outside the home and making sure the loved one gets there. So those services and that emergency room run, I mean, when you cut down on running back and forth to the emergency room, that saves us financially, that keeps Medicare costs under control. And it just makes for a better relationship between a loved one because who wants to sit in the emergency room?
Right.
I mean,
Right.
that was just not my thing. I hate the emergency room, and like I said, now
Mhm.
with COVID, I really hate it. So
Right.
our
Yeah. There's,
goal is to, minimize those emergency room runs, try to keep a loved one at home as long as they possibly can in their own home, in the care of their family, where they want to be, where they should be, living out their best life, their best days in the comfort of their own home.
so how long are they there at the Independent Adult Day Center?
The
You
an
pick up
hour
at what time?
An average day, I guess, it's probably, I would say, anywhere from 5 to 8 hours a day. So, and you can pick the one thing about us, we're not contractual, so you pick and choose your day. We have on average guests are here Monday through Friday for a minimum of 8 hours. Um,
Mhm.
we are open 9 to 5 or 8 to 5 right now. Those are our COVID hours. Before COVID, we were 7 to 7. And I don't know if we'll go back to 7 to 7 or not. Our goal is to go back to 7 to 7, but right now we're 8 to 5. And so we do have a few guests in here that are here all day. Um, but
Oh,
most of them are here 3 or 4 times a week, 4 to 5 hours a day.
okay. Now we
Mhm.
just got about 3 minutes left, so I'm gonna hit a
Okay.
couple of questions because I know people are watching. Like, I want to know about
Yeah,
this. So,
great.
what about healthcare coverage?
Yep.
Is it
So
covered by insurance?
Yep. So most private insurance do not cover it. There is supplemented through Medicaid. So if we do have if a loved one has Medicaid, they can get a waiver. And waiver covers 100% of the services, the transportation, the meal program, and the adult day services, bathing services, all of that would be included.
Okay, okay. And when is a good time to consider adult day?
I would start considering when you start noticing that your loved one is starting to have some trouble with their ADLs and you're not able to keep up with them. And that ADLs is when their activities of daily living, when they're no longer able to keep themselves clean, or they're having trouble with their gait and unbalance, and their memory issues, things like that, and you're not able to manage it as a caregiver, then that would be a great time to have that conversation.
Okay. Now, where are you guys located?
So we have 3 locations, one on the northwest side at 87th and Guyan Road, and then we have another location at Fishers at 116th and Allisonville, and then a third location at Shelby and Raymond.
Okay. And
Yeah.
what would do you say to people who are concerned about the COVID-19 pandemic?
Yeah, so that's a huge thing. So we took all of the precautionary tales that went into shutting down the center. We were closed down for a while. Now that we're reopening, or have reopened, I'm sorry. We're doing all of the sanitizing that the CDC has recommended above and beyond. So every hour we are taking our guests' temperatures. We're cleaning like crazy. We COVID test weekly, all of our guests and our staff every week. And we don't just do the light one. We are up in that nasal doing a real COVID test, sending it off, getting those weekly testing. We're just reassuring them we're staying on top of the facts and not the fictions. We're listening to the CDC's recommendation daily, and we're making those changes as those changes are required for us to make. it's scary. I mean, you don't know, your mail could have COVID on it. So it's a scary,
Yeah.
scary thing. And so everyone has a right to be fearful, but we cannot let that fear drive us from living. So we just want to encourage people not to stop living, but know that we are trying to create as a safer environment as you are, because I have to work in this environment. I don't want COVID either. And I definitely don't want to take it home to my family.
Right, exactly. So, well, we're going to have to wrap things up, but I just wanted to mention
Yeah.
some of the things you offer: daily exercise programs, podiatry care, outings, therapy, door-to-door transportation, counseling, lifestyle enrichment activities, and an in-house chef.
Yes, how about that? I mean, food is everything, right?
There you go.
Food is
I don't get it. I don't have a chef at home, so
right, and good
I'm
food
counting with this
means the
program.
world. Yes,
I
yes.
love it. Regina Smith, Executive Director of Independent Adult Day Centers. And again, her locations are Northwest, South, and Northeast in Hamilton County, right?
Yes, that's right.
Okay, we got your information on the screen. Thanks so much for joining us on Inside Indy.
Thank you so much for having me. Thank you very much.
Bye, Janet. It's nice seeing you
See you
again.
soon.
You look good, girl. Just let me know what I can do to help.
Well, to help me, she'd have to help every day. Every hour, every ouch, every time my wife calls for help. I mean, maybe she could help me make her lunch. But the crust, all the crust has to be cut off the corners. She could help me run to the doctor for the 5th time this week. Help me with the specialist and the second opinions and the painful paperwork of our paperwork. Help me deal with how hard it is seeing my wife's name on so much paperwork. But this is on me. I'm the only one who can do this, like this, for her. Besides,
Take care.
we will. Janet doesn't like her cooking anyway.
Find support for your strength. Visit aarp.org/caregiving for care guides and community.
So there you are, shuffling through a stack of resumes and you come to mine. This is it, first impression, my way in. But can my resume show you how I truly stand out? Like that I was studying, going to night school while working 2 jobs just to help my parents pay for groceries. Or being the first one to always step up. No, that's something you just can't put on paper. Look beyond the resume and discover new ways to develop great talent that is dedicated, hardworking, and determined like me.